episode number 7 of Posture Matters. I'm Dr. Paula Moore, the online posture doctor. Today's going to be an interesting little lesson, and there's an important reason for this because we're discussing back pain, lordosis, and whether or not you have it. And I'll tell you why we're going to be discussing this. I'm wearing glasses because I'll be drawing shortly in a moment. I get a lot of questions on YouTube, a lot of comments, a lot of emails to me, and I see this a lot in forums. People saying, I think I have lordosis. My answer to that is, I sure hope you do. I think the confusion lies in the way that we're misusing the term lordosis. So let me give you a little lesson here. See if I can straighten out the confusion. So let's just draw in my little person here. So we definitely do have a lordosis. We should have a curve, another curve, and another curve. Okay, I'm exaggerating them here. Ideally, we have a curve in at the neck, a curve out in the mid-back, and a curve in again at the lower back. The curve in is referred to as a lordosis. S-I-S, Paula. Lordosis. We have another lordosis in the lower back, and we have a reverse, a kyphosis, in the mid-back. This is what we want to have, a curve in, a curving out, and a curving in. I think where the confusion lies is when people talk about having a lordosis, what they really mean is that they have an exaggerated curve. And that's actually known as a hyperlordosis. We can also have a hyperkyphosis, kind of a hunchback posture. We can also have a hyperlordosis in the neck, but that's less common. What we often find is somebody that has a flat curve in the neck area, often an exaggerated curve in the thorax, and we can also see somebody with a flattened curve in the lumbar spine. This is your sacrum bone down here. This is not to scale, clearly. You don't generally have flattened curves and an exaggerated curves all at once. Now, what causes flattened curves? Well, that's for another tutorial. This is usually trauma related. Car accidents are really common. When we have a flattened curve in the low back, so you look in the mirror and you often see a flat area, that's usually the result of degenerative disc disease. It's unfortunate that we call that a disease. It's more of a process over time, a degeneration of the discs. And the discs are kind of wedge shaped. So we've got, if we look at a side view of the lumbar spine, as I said, it goes in. We have these vertebra. This is kind of sideways on. And generally, the discs are kind of wedge shaped, like this. They're wedge shaped. This is a side view. And that would be the curve. When somebody loses the curve, what happens, here's the bony vertebra again, the discs kind of dry out and pancake. And this wedge that lends itself to this curvature here causes a flattening in the back. We end up with these dried out wedge-shaped pancake-like vertebrae. What causes degeneration? There are a lot of factors. So certainly habits over a lifetime, the way we sit, sports, being very active as a child, some genetics, yes, but far more associated with our lifestyle. Now, what I really wanted to talk to you today is about a really common myth associated with discs and curves in the spine. So the myth is that it's the discs in the spine that give us our shock absorption. You often hear practitioners talk about the spongy discs, our shock absorbers. Well, that's not true. In fact, The discs aren't the shock absorbers, the curves are the shock absorbers. The job of the disc is to transmit or spread the load over the spine. So the discs spread the weight, they distribute the weight through the body, and the curves give us our shock absorption. That's why we care so much that you've got the correct spinal curves, or at least I do. That's where the structure is so important here. So if you've got a flattened area here, suddenly the shock absorption isn't as great. Let's look at a little analogy. I've got a little paper left here. I love this analogy, the analogy of a spring. So a spring has a lot of curves in it. Think of the space between the springs as the discs, and think of the coils themselves as the curves in your spine, giving you the shock absorption. So you know when we've got a coil in the spine, or a spring, let's look at the spring again. When a spring is really close together, oftentimes it's not that spongy anymore, right? But look at this spring, where we've got lots of space between the coils. We've got a lot more sponginess or shock absorption in that spring than we do here. So we want good space between the coils, and we definitely want coils. What happens when we take a spring like this and we pull the coils out? It doesn't have a lot of shock absorption anymore, does it? You can think of when you pull a little spring that comes out, I don't know, of some electric contraption. If you were to pull it out like that, it loses that nice shock absorption. Well, that's a little bit like the situation here we see when someone's got a flattened back. Suddenly, instead of the nice shock absorption that we have in this, where there's good space between the curves, we have a lost height. And what ends up happening is now the forces are going straight down through the bones, and we've got these little joints that attach themselves to the vertebra, called the facet joints. And now suddenly the mechanics, the load on those joints is very great. And that lends itself to inflammation. You're a lot more prone to inflammation around these facet joints now in this situation, in a flat back spine. So let's just flip it back. My point is that discs aren't shock absorbers. Spinal curvature are the spinal shock absorbers. The discs simply transmit, spread the load, and think of that little spring analogy. So what can we do if we do have a flat back spine? We'll talk more about the other kind of curves in the body in other live feeds. What can you do if you look in the mirror and you see you've got quite a flat back? I often see this on men who've been very active in competitive sports. I'm live again. For some reason, where I live in the country, we get a lot of cutouts in the internet. So you just lost me there. I'll try it later. So basically, I'm going to show you a little exercise, a great little exercise you can do at the office or when you're sitting for any of you with flat back posture. One of the corners here, I think it's going to be this one here, top corner, you can subscribe to the feed so you never miss one of my tips. All right? Sometimes there'll be a little video here, which I'm going to add in today, so that you can see a great little exercise for you to practice if you do have flat back posture. And by the way, a loss of lordosis is called an alordosis, a meaning without. I think it's Latin. So we've got hyperlordosis, too much lordosis, lordosis, the ideal, what we should have, an alordosis, loss of curve. So there'll be a good little exercise for you right there. And then each time I'm going to post a little link here for some really fabulous posture swag. If you click on that, You'll find how to join the Movement Posture Matters and grab the first t-shirt that we've ever designed. These are super cool. We've had 175 entries and they're about to launch imminently. So make sure you're on the list so you're the first to know. Okay? So subscribe, check out the exercise, and check out our swag. Thank you for watching and for your patience for all the technical glitches. I'm sorry, I do live way out in the sticks in ski country. I'll see you again tomorrow. Thank you for tuning in. I hope that was helpful and that you learned something. And if there's anything you want me to cover in future live feeds, post it in the comments. I'm going to be addressing questions and using those. And if you want me to give you a shout out, let me know your name and I'll do that. Okay, thanks for watching. See you again soon. Bye-bye for now.